So my project is factitious disorder. Factitious disorder is defined as a type of umbrella category that covers a group of mental disturbances in which patients intentionally act physically or mentally ill without obvious benefits. It's characterized by physical or psychological symptoms that are intentionally produced by a person and are under voluntary control. The history of this diagnosis, well, it hasn't been diagnosed until about the late 1950s, but there were similar cases discussed all the way back in the 1800s, just not labeled factitious disorder. There was a book that first derived the term factitious in 1843, and by 1980, the term was finally recognized by the DSM-3. Munchausen syndrome, which I'll talk about later, was named after a well-respected German officer from the 18th century who displayed signs of this disorder and was somebody later wrote a small story about it. Symptoms of this disorder include the individual has a long record of admissions at many hospitals in different cities. The individual also has an unusual knowledge of medical terminology as if they were reading it straight from a textbook. The patient has a psychological disorder where they provide elaborate and specific detail about events that never happened, like they have a grand story about a time that they had a seizure when really they never had a seizure. These patients feel like they're extremely important, yet every time they check into a hospital, they usually have very, very few visitors. These individual symptoms develop very quickly because they're over-eager and they are way too accepting to undergo surgeries or other kind of scary procedures. The symptoms of, whatever the patient is saying that they have seems to only be present when there is a doctor around. And many patients have what doctors call gridiron abdomen, which is many surgical scars or evidence of self-inflicted wounds from multiple times coming to the hospital. Causes of factitious disorder is mainly because patients are trying to reenact unresolved childhood problems with their parents. The need to deceive physicians and is because it makes them feel superior, and these people don't like feeling vulnerable, so they don't like being confronted by physicians about lying. Many patients crave being the center of attention, and they feel that they are important all the time. That's why they like the attention of doctors all the time. And then many, many individuals with this disorder have underlying problems with masochism. There are not very many misconceptions about this disorder, but mainly medical professionals and psychologists debate whether or not this disease is underdiagnosed. Many people believe that this disease is underdiagnosed because doctors don't recognize the symptoms right away. There are different kinds of factitious disorder. The first one is psychological, where the patient feigns psychological symptoms, and the symptoms are extravagant and kind of almost seem unbelievable. The symptoms frequently change and are usually influenced by the individual's environment. Another type is physical factitious disorder, where the patient inflicts wounds on themselves to go to the hospital. This is the most common form of the disorder, and many patients will come to the hospital with well thought out stories of things that never happened, or they will add things like blood from, a finger prick or a scrape to their urine to make it look like there's a problem. Most of these individuals relocate to new hospitals because they are frequently confronted about their fraudulence after lab tests are run. And then there's another type where basically individuals display signs of both physical and psychological factitious disorder. A type of factitious disorder is Munchausen syndrome. This is the most severe and persistent form of factitious disorder. These patients inflict injuries on themselves very often and will even go to the extent of trying to mess with tests to change lab results to avoid fraudulence. This subset is very difficult to treat because it's so persistent and subjects move from one hospital to the next, that a lot of times these individuals will die due to the wounds. Another type is Ganser syndrome, which recently has been classified under dissociative disorders, not otherwise specified, rather than a factitious disorder. But for a while, it was a factitious disorder. And the main features of the syndrome are clouding of consciousness, somatic conversion symptoms, and hallucinations. This syndrome, once studied on patients, shows that these patients have problems with their frontal lobe. Treatments of this include medications. However, medications are not the most helpful type because many patients will overuse the medication in hope of then causing a problem to bring them to the hospital another time. But a lot of patients with factitious disorder show signs of anxiety or depression, and so medication for anxiety or depression are commonly prescribed. The most common and effective type of therapy is psychotherapy. The one problem with therapy is that these patients do not tend to stay in therapy for long enough for it to have a beneficial effect on them. A lot of patients also will refuse therapy if it's suggested to them. But the most beneficial type is supportive therapy, like where the therapist focuses on the individual's emotional distress rather than confronting them about the anger from the hospital staff and how many times they have been caught about being a fraud. Family therapy is extremely helpful because it helps the family understand the patient's problems and their need for medical attention. Lastly, sometimes legal actions are taken because doctors and many hospitals waste over $40 million a year around the world on unnecessary procedures and treatments due to these feigned illnesses. So sometimes hospitals will put hidden cameras in their hospitals to expose an individual's fraud. This is an example of factitious disorder from Grey's Anatomy. Oops.
So we're in the middle of the Belizean jungle, and this jaguarundi jumps out and bites one of the guides. They all look at me. They're yelling, "You're a doctor, help him." This is one time a PhD does no good.
I'm sorry, did I miss the bell for social hour?
Tales of missionary life.
You're a missionary?
No, my parents. We traveled a lot. They still do.
Wow, this stuff is great. This is Dr. Burke's patient, Kalpana Vera.
Kolpana, named by villagers in Nepal.
She presents with multiple syncopal episodes and ventricular arrhythmia.
So you've been passing out?
Yeah, and having palpitations.
Past medical history of rheumatic heart disease with mitral valve stenosis.
They had to ship me from Zambia to the States for 3 months of treatment when I was 8. Rheumatic fever almost killed me.
Dr. Stevens, what are the primary causes of ventricular arrhythmias?
Valvular disease, mitral valve prolapse, stimulants, drugs, and metabolic abnormalities.
Scrub nurse to OR6.
What?
Scrub nurse to
Out.
I saw that. I saw you take that pill.
Oh, it's my pill. You know, the pill.
It's not in your chart, and you're supposed to tell us on the meds you're on.
You're not my doctor. You shouldn't even be here.
She's right. You shouldn't be here. I saw her take unauthorized medication.
I'm on the pill. And I had grapefruit juice this morning. Since the juice inhibits enzymes involved in the metabolism of OCPs, I thought I'd avoid the interaction by taking it 2 hours after my meal.
She has a doctorate in neuropharmacology, Christina.
Well, Izzy, I don't see oral contraceptives.
Okay, well, now you will. Would you just go back to bed and stop trying to poach my patients? This is ridiculous. Could you just go back to bed and stop poaching my patients? She's in B-Fit. Color code.
Gold blue, second floor. Second floor.
No code?
Not anymore. Can you help us get her back in bed?
I'll help. Just give me a minute.
Would you just go back to bed, please? Seriously, go.
Oh, God. You know, Izzy, if she's on OCPs, we mark it down, okay?
Yeah.
You scared us a little there. How's the workup coming?
Electrolytes are within normal limits. Urine tox was negative and EKG's fine. Till test is scheduled for noon. Oh, and she's on contraceptives.
So?
That's what I said. Other doctor made such a big deal of it.
She didn't tell us before, so I documented it in her med list.
What other doctor?
Christina, she was wandering the halls.
Fine. Take her down for an echo.
An echo? What about cardioversion or ablation? Won't I need a pacemaker or a permanent internal defibrillator?
Although it would be unusual for rheumatic heart disease to cause ventricular dysrhythmias, we still got to check your valves.
I thought your doctorate was in neuropharmacology, not medicine.
It is.
It's odd.
It's odd that I'm not jealous.
No, you have every right to be jealous. It's your territory and she's peeing all over it. What's odd is Burke's patient. She's been in 4 other hospitals this year. You know, something's not right. Hey, Izzy, how are studies?
Hey, I have been looking for that everywhere.
Negative, right?
Oh, the echo test showed mild mitral stenosis. The TIL test was negative. We're doing EP studies.
I can tell you what's wrong with her without sticking electrodes in her heart.
Really? Just by the chart.
No, from the pills she took.
They were contraceptives, Christina. Why are you so obsessed with this? Just go back to bed.
I think she's doing this to herself.
You think she's inducing ventricular arrhythmias? She'd have to be crazy to do.
No. She'd have to have Munchausen's.
Okay, wait. You think she's secretly ingesting something to produce real symptoms? Seriously?
Yeah, just run it by Burke and tell me what he thinks. I mean, she obviously loves the patient role. I mean, she practically lives in hospitals. And we're like an imaginary family to her because her real family blows her off to go take care of other people. And I saw her take something.
It's not enough. We have to rule out everything else, everything physical.
She even lied about her job. She's a pharmacy tech, not a PhD.
So she's a liar. I've been lied to before. We're using 3 different catheters. Why are we doing that, Dr. Stevens?
Programmed electrical stimulation maps the heart's electrical system to find the focus of the irregular heart.
Doctors? Sorry to interrupt.
Yes.
Her urine's blue.
What?
Why is her urine blue?
Blue urine?
A second drug screen was positive for amitriptyline, which, I'm sure you know, causes ventricular arrhythmias.
You knew it wouldn't show up on a routine drug screen, but I'm guessing you didn't realize it would turn your urine blue.
I didn't do this to myself. You have to believe me. I'm sick. I'm sick. I have something.
No, you're just deceiving yourself. Manufacturing things that really aren't there. Seeing only what you want to see. Wasting our time, our resources, and throwing away your own life. Your illness is in your head, Kalpana. We will be transferring you to psych.
So that was the end, and then my works cited will hopefully load in a second.